Welcome back for our final video. I hope I didn't scare you by saying there were 7 more muscles because there's really only 5 more muscles. I'm going to talk about 7 muscles this time, but there's only 5 that are new. So let's go ahead and get started. So where we want to do is look at the lateral aspect of the leg and realize that the first 2 muscles are muscles we have already seen before. That's the gastrocnemius and the soleus. And let's continue across and look at all these other muscles. So we're going to go from a posterior to an anterior direction, starting with what we already know and then moving into unknown territory. So the first muscle that you see is called the fibularis longus because it's just lateral to the fibula. And when you look at it, the muscle fiber direction is in a straight proximal distal direction. And this muscle actually has a fairly long tendon that goes down. Now, if you look closely around the tendon, like for instance in the picture on the right, what you can see is that it looks like there's muscle fibers coming in at an oblique angle. And that's because you can see muscle fibers that are oblique, but those oblique muscle fibers are not part of the fibularis longus. They are part of a muscle which is deeper, and you're actually just seeing it on the sides of the tendon of the fibularis longus. And so that muscle that's deep to it is called the fibularis brevis, and its tendon sits directly behind the tendon of the fibularis longus, which is why you don't see its tendon. So both of these are lateral muscles, so they are going to do that lovely movement. What was that called? That's right, eversion, okay, because they are lateral muscles. All right, continuing anteriorly, the next muscle, you can clearly see, once again, the fibers are going in a proximal distal direction, but down here at the ankle, this one divides up into a bunch of tendons to go to a bunch of digits. So digits 2 through 5. This is the extensor digitorum longus. Okay. And so this one, the extensor digitorum longus, basically is going to be doing dorsiflexion, and because it inserts all the way here on the distal phalanx, we'll be doing extension at the MTP, the PIP, and the DIP for digits 2 through 5. Continuing on, the very next muscle, and we are all the way anterior to the tibia, is called the tibialis anterior. So notice the tibia is not completely covered. It only goes up to that anterior border of the tibia. So the tibialis anterior, and this was the one that you use a lot when you are driving long distances, because this one does a lot of ankle dorsiflexion. So you often end up, if you're driving all the way to San Francisco one day, you're going to end up with some pain in your leg from this muscle being over-exercised. All right. So it seems like we've covered everything except, remember we talked about extension of digits 2 through 5, but we didn't talk about extension of the big toe. And you go, well, Dr. Powell, going across here, I just don't see any other muscle. We've covered all of them, and I'd go, that's correct, because this muscle is deep. And so in order to find it, you have to look all the way down here at the ankle. And all you're going to see is either a little sliver of the muscle or the tendon. Okay, so I want to point out that this picture on the cadaver is a left foot, as is the middle model is a left foot, but the far right model is a right foot. Okay, so that's why you're going, wait a second, doesn't look like it's in the same place, because we're comparing right versus left. So now you see what it looks like on both. And you have one where you can see muscle at the ankle, and then one where you see mostly tendon at the ankle. So this one is going to be extending the big toe at the MTP and the IP joint. So it's called the extensor hallucis longus. All right, so now I have something that can help you figure out what's what and what's where. And to do that, we are going to look at a lateral view, start posteriorly and go all the way anteriorly. And where I want you to start is up here in the calf muscle area. The first muscle, the most posterior muscle, whoops, That's the gastrocnemius. I have it labeled incorrectly. The second muscle is the soleus. So for all of these from now on, these two words are going to be backwards. So please change this. Okay. Is the soleus. The third muscle, what do you think the third one is? Go straight up and down, lateral to the fibula. That's right, the fibularis longus. Continuing anteriorly, follow it distally. Do you see it splitting into 4 tendons for 4 digits? So it's muscle number 4, which is the extensor digitorum longus. This is why we have to start counting posteriorly, so all the numbers match up. And then the most anterior one is the tibialis anterior. So that's at calf level. But now let's go distal, just above the ankle level. And at level 3, where we have the fibularis longus, we have a deeper muscle. So I'm going to change fibularis longus to 3A. And then 3B will become fibularis brevis, B for brevis. And then the 7th muscle is the one that's between muscle 4 and muscle 5. So I'm going to call it muscle 4.5. And that's the extensor hallucis longus. All right, so hopefully that helps you. Go back to the previous slide where nothing was labeled. Then take this to the model pictures and practice doing it on all the various model pictures. And with that, congratulations, high fives, high tens to everybody for making it all the way through all the muscles you're going to learn in this course. Kudos for you, and I really appreciate all your hard work in this part. I'll see you again as we continue on our journey in another organ system.